Well, check it out. If it's Wednesday morning, it must be time for another About Mansfield Consumer Advice Series episode. I'm Steve Casillo. Appreciate you being here today. You are either watching live on Facebook right now. It's Friday morning. It's 10 a.m. Or you're watching the video replay on YouTube or LinkedIn, or you're listening to the podcast on your favorite podcast platform. Say that 3 times real fast. And today, as we do every Wednesday morning, we are talking about health and wellness, and more specifically, we bring in our health and wellness guest right here. She is Dr. Jordan Adams with Calibration Chiropractic and Functional Health, based right here in Mansfield, Texas. Say good morning to the audience.
Well, good morning.
And good morning to you. Today, we are, as we are doing our series on health and wellness and how it relates to pregnant women. To recap last week, we talked about the first trimester. Today, we're talking about the second trimester. So let's go back just last week for just a second here. And you had mentioned a couple of the concerns or complaints that pregnant women have. And let's go ahead and recap last week, which will take us into this week. The two complaints that pregnant women have in the first trimester are...
So most of the time, the most common complaints in the first trimester, like we talked about last week, are increased fatigue and morning sickness or nausea. Now, the good news is that as most women transition into the second trimester, both of those complaints do tend to decrease. So the morning sickness typically goes down unless you are one of the unlucky ones who unfortunately has morning sickness the entire length of pregnancy, which there are medications that can help manage that. The other thing is our energy in the second trimester goes way, way up. It's
okay,
also known
that
as the
helps.
golden period of pregnancy.
All right, so the first trimester woman who's basically couch bound because the energy is zapped, and you had mentioned because you're now producing another human being, and that it's so that's your energy is not only focused on you, but your energy is also focused on the fetus. And the second trimester, then they don't have to stick to the saltines and the couch. What are some of the most common challenges in the second trimester?
Let me start with the most common one that I typically see as a chiropractor, and that's going to be back pain. So as we go through the second trimester of pregnancy, our posture tends to shift. We start to see an increased lordosis, which is an increased curvature of the low back. With that comes a pelvic tilt, and we compensate by rounding our upper back. And so we can see not only the back pain and SI joint, which is sacroiliac joint instability, but also upper back pain and neck pain or headaches can all start to appear. Now, the good news is chiropractic care is traditionally phenomenal at back pain. Particularly in pregnancy, there is a type of assessment that some chiropractors do have extra training in. It's called the Webster Protocol. And that's a specific way of looking at pelvic imbalance and treating that imbalance to help not only the back pain, but to help create more ease and space in the pelvis so that even baby can have more room to grow.
So as the pregnancy period goes on in the second trimester, then there's some weight gaining going on. There's and that's having an effect on their spine, and chiropractic care does help.
Absolutely. It's phenomenal. And, one thing I hear a lot is, well, I didn't know that I could get chiropractic care when I was pregnant, or I didn't know that it was safe. And it's very, very safe. It's very effective. So a lot of moms get tremendous relief with chiropractic care.
And you mentioned the Webster, specifically go into that again, and what that's what's involved with that.
Yeah, so the Webster Protocol is, just to put it really simple, it's a very specific way of looking at pelvic imbalance throughout the SI joints, the hip joints, the low back, and how we address that imbalance is very specific as well. So it's just a very specific way of looking at imbalance during pregnancy.
And what are some things women can do to support themselves in the second trimester?
So postural awareness is one thing that I find if we start adapting a postural awareness perspective earlier on in pregnancy, it can safeguard us as pregnancy progresses. And so what I mean by this is when we're sitting, we want to make sure we're sitting up on our sitting bones. We're finding space along our back all the way up through the crown of our head. And we can practice this whether sitting or standing, just really bringing awareness to the back body. So often in life, we are so front focused that we forget to check in with our back body and make sure that we're having good postural control.
Okay, so posture. I've got this really nice leather chair that I tend to sit back, and so posture is really important because it has a lot to do with the spine and here, let me sit up again. So I am showing good posture here. I know that one of the words coming out of a chiropractic office would be subluxation, and so that's what's going on. That is the well, you're the expert. Define subluxation and how that applies to pregnancy.
So subluxation is really just a misalignment, a subtle misalignment of a specific joint. And so as chiropractors, we go through the spine and figure out exactly where those subtle shifts or subtle misalignments are so that we can feed more appropriate input into the spine and into the nervous system.
All right. So even if one little spine joint is out of alignment, that is called subluxation. That can happen through improper sitting, improper standing, slouching, and that's why people go to chiropractors. Well, not the sole reason why people go to chiropractors, but that's and working with pregnant women, especially in the second trimester, where things are starting to change in the body, that's where chiropractic help can come in.
Exactly.
Okay.
And so there's some other. Oh, go ahead. Sorry.
Yeah, I was going to ask you if there's anything else that you wanted to add in the second trimester.
So let's see. One other thing I see a lot of, or women complain a lot about during the second trimester is they start to experience leg cramps, particularly in their calf muscle. And that can be causative either due to dehydration or not enough mobility, or sometimes even potassium is low. Mm-hmm. And so some simple fixes there are to do some light calf stretches before bed, to do make sure you're drinking some coconut water or a banana, or even a topical magnesium lotion can be really good at decreasing those muscle spasms.
As a tennis player and also as a musician who either sweats a lot on the tennis court or sweats a lot on stage, leg cramps is something that I'm very, very familiar with. And the way that I can't remember who this was because I learned this about 10, 12 years ago. Pickle juice. Have you heard about the wonders of pickle juice?
You know, I've had someone mention it to me before. I have not looked into it, but did it work for you?
It not only worked past tense, but as recent as last night, I'm sitting at the in my couch, slouching and with poor posture, and actually I got a cramp in my toe, and I got up, went to the refrigerator, drank about 2/3 of a cup of pickle juice, and within 30 seconds, not only did the cramp go away, the pain went away, and from what I'm gathering, it's because it's high in salt and something having to do with the salt in the vinegar. I don't understand it, but if I play a tennis match or if I'm out playing music, the first thing I do before I go to bed is I drink pickle juice, and my cramps have they've gone away.
That's fascinating.
So I buy pickle juice by the gallon, and which our local grocery store sells. Yeah, it's amazing. So, but the one caveat to pickle juice is that because it's so high in salt, if you suffer from high blood pressure, this can also add to it. So this is not medical advice from me. So, but yeah, I swear by it. My cramps go away like that. I don't understand it, but that's what happens.
I think you're right. I think that it has some electrolytes in
Yep.
it because it does have the sodium and some vinegar. And so a lot of times we'll find that as long as we're supporting the body through a good amount of electrolytes and micronutrients, things like that, that a lot of remedies do tend to work. So I think the pickle juice and the electrolytes is probably what's happening.
So bananas, coconut juice, and let's pull this all back to the second trimester as we kind of took a little left turn there with tennis and music. Any final advice for those that are in their second trimester of pregnancy?
I think we've about covered it. The biggest thing is if you have a Webster certified chiropractor near you, that can help you a lot.
If someone had any questions about pregnancy and if they wanted to reach out to Dr. Jordan Adams, where can they find you?
As always, our website has all the information just to make it super easy for people, and that is calibrationmansfield.com.
We do this every Wednesday morning, Dr. Jordan. These little 10-minute nuggets of information are invaluable, especially to those right now who are in their second trimester. If you missed last week, go back and through the archives, you can find it on Facebook, LinkedIn, YouTube, or listen to the audio on the podcast about the first trimester. Am I to assume next week is the third trimester?
Correct.
She said yes. Okay, very good. Let's do this again next week.
Bye.